Hi, my name is Kalen Reed. I'm in Section 2 and I'm doing my primary IV medication administration. First thing I would do is walk in the room. Hi, how are you doing? My name is Kalen. I'm going to be your nurse today. Could you say with me your name and your date of birth? Alright, perfect. Okay, and do you have any allergies that you know of? Okay, no? Alright, that matches with your MAR. Have you ever had vancomycin before? That's what the doctor has ordered for you today is vancomycin. It's the antibiotic. Okay, you've never had it before. Okay, I mean, you've had it before. Yes, you've had it before, so you understand understand what it is. You don't have any allergies to it. I'm going to compare my vancomycin, look at my dosage again. It's available 500 milligrams to 1 milliliter. I've done my math, and I'm administering 1 milliliter, and I've also already calculated my drops per minute, which is 17. Okay, now I've already did my hand hygiene, so now I'm going to get ready to draw out my medication. Okay, I'm going to go ahead and look at that IV site though and see. I don't see any phlebitis or infiltration, no redness, inflammation, cold, wet, leaking, anything like that. Okay. Okay, now what I'm going to do is get this, clean the top of my vancomycin. Okay, do my 1 milliliter. Look at my MAR one more time. 1 milliliter. Vancomycin. Check that. Drop my 1 milliliter. Alrighty. That wouldn't go in the sharps just yet. I would go ahead. Look at my bag, my medication. Right, stick my vancomycin, 1 milliliter in the bag, put this in sharps. Okay, now I've got my medication in the bag. I'm going to mix it up a little bit. Alright, and at this point I would put my label on the bag, which is the client's name, the drug, the dosage, the time, and my initials. Alrighty. Now that's ready to go. Now on my tubing, I'm going to go ahead and connect it and put my label on my tubing, which is got my date, time, and initials. Alrighty, so that's ready. Go ahead and connect my tubing. Alright. Okay, prime that, make sure it's good. Alright, good. Okay. And then I want to check my drip factors. Good, okay. Alright, now let me go ahead and plant this back. Okay, hang my medication over here. This side so they know what saline it is. Alright, you doing alright, Miss Jackson? Okay, that's ready for when it's time to do the medication. Now I'm getting ready to go into my ASASH procedure. I'm going to get my saline, clean the top off. Alrighty. I need 6 milliliters of saline. Alrighty. That would go into the sharps. Now I would come over here and observe my site again. No phlebitis infiltration or anything like that. Clean the port. Alright. And then stick my syringe on here. Aspirate. And I got blood return to verify my placement. And then I'm going to administer just 3 milliliters. Alright, and my 3 milliliters is administered. I'll do this. Okay, come back over here. Now we're getting ready to hook up my vancomycin. Clamp it. Just good to go. Alrighty. We did unclamp that. It's done. Clean my site once again. Okay. Clean my site. I've got my medication. Okay. Alright. Okay, clamp. Make sure I'm getting 17 drops per minute. Okay, and I am getting my 17 drops per minute. Okay, let me observe my site one more time, and everything's still looking good. Alright, I'm going to go ahead and let your medication drip for an hour as it's supposed to, and I'll come back and assess everything and see how you're doing in an hour, okay? So I'll leave. Before I would leave, though, I would take off these gloves because I am leaving the patient's room. Document that I've administered my medication, and then I come back in my hour. Come back in. Hey, how you doing? I'm coming to check on your medication again. Do my hand hygiene. You feeling okay? Alright, good. And it does look like your medication has completely finished dripping. Let me put my gloves on. Okay, now that these are good, alright, and let me go ahead and observe the site. Once again, no infiltration or phlebitis present. Clamp this off. Alright, unhook this medication. Alrighty. Okay. Alrighty, and right before I do my saline again, I need to go ahead and have a new alligator clamp ready to go. At this point, I would hang a new alligator clamp for the next administration. Okay. Come back over here and clean my site again. Let me get a new one because I dropped that. Clean my site. Administer my 3 milliliters of saline to flush. Alrighty. Okay, take that out, and everything will go in the sharps in the trash. And if I was doing complete ASASH, I would administer heparin, and that would be for like a PIC line or a central line. At this point, I would dispose of all my needles, make sure all my sharps are taken care of, make sure my patient's comfortable, that he doesn't need anything else, and I would document. My documentation, I would document that I did use the MAR to verify my medication. It was at 0300 vancomycin, 500 milligrams peripheral IV, no phlebitis, redness, swelling, or inflammation, no infiltration of the IV site, 50 milliliters of fluid, used to deliver the medication in the mini bag. I would record my intake and output, and this is my documentation.